Excellent, thank you. And welcome everyone. Um, for our final presentation for the 2026 Virtual Learning Institute, ARCA thanks you all for attending and being part of this event. We hope that you've learned lots and have enjoyed the programming. We've had a diverse group of folks presenting over the course of this past month. And incredible topics that we hope you'll be able to put in your toolbox and be able to use in practice or down the road with your clients, students, participants. Just some housekeeping. We're asking folks to please remember to keep your mics off. And questions will be answered near the end of today's session, so put them in the chat. Don't be shy. A couple of you have had some really great questions, and we want to keep those going. Today's presentation is Building Authentic Partnerships, Community Engaged Participatory Action Research. And today's presenters, we thank you both for being here. Dr. Andrea Nerlich and Dr. Allison Fleming, and they have their own bios ready to go. So I'm going to turn it over to you. Thank you.
Thanks, Chris. And I guess by way of bio, I'm not going to offer too much, but hi, I'm Andrea Nerlich. I am professor, program director, and department chair of counseling and mental health professions at Hofstra University. So I'm the director of our clinical rehabilitation counseling program and rehabilitation counseling program. So I've been at Hofstra for 20 years now, and I have background in community-based rehabilitation, some work in private for-profit as well, but most of the work I've done has focused on transition and assessment and professional development of counselors and students. So I'll toss it to Allison before we move forward.
Thanks, Andrea. Hi, I'm Allison Fleming, and I'm an associate professor at Penn State University. I think I've been here for 11 years now. I am a native of the Northeast. I grew up in New York, and then I did my counseling work in VR in the Boston area. Um, that VR work really has informed the research that I do now. So a lot of the research that I put out is about employment and disability. I also have a focus on transition, and I'm very lucky to have some strong community partners in Pennsylvania State VR, in Colorado State VR, and a number of other places that I really enjoyed working with along the years. So that's me.
So, yeah, and I'm happy because, when I tossed this out to Allison, although we didn't go at the same times, we are both graduates of Springfield College and Michigan State University. So, any chance that we get to collaborate on something together makes me happy. So I think we have definitely some projects, excuse me, across our bodies of work. And I think it's something that, engaging with our communities is something we're passionate about. So just to kind of kick it off here, just a quote, the Center for Justice Innovation, I thought summed this up well. In terms of participatory action research, I think I keep stumbling over that word, but the idea that oftentimes we consider as researchers or as academics, our need for output, but really that participatory action research is the focus on the community and, really getting into their stories and being able to enact change on that. So we want to really have a conversation around this PAR model. I know it's something we both use. It's something we're both, drawn to. I mean, I am kind of a data nerd and I do like, assessment and all that kind of thing. But every time I see a set of data, I always think to myself, like, but like, what's behind it? But like, why? And so participatory action research really looks at, who has the power to define the problem, and then interpret what we find, but also the part that I think is missing is, deciding what happens next. And that's really where the action comes from. So today we're just gonna go through, and talk about, some of the foundational concepts of PAR. And then really, we would like to think that we're talking about this and there's so many upsides to it, but there are challenges to it. I think that, As I'm always telling my students, quantitative data, you get some numbers, you throw it in SPSS and you get your data, and that's what you do. But what we're trying to talk about is, getting deeper into the stories and the experiences and varying viewpoints, and, really getting buy-in for that. So we'll talk about the benefits, challenges, and principles, and how it's not a one size fits all. There's not just one way to do it. And so we want to be able to present to you some examples of how to put that into action. We can talk a little bit about, or we will talk a little bit about how to incorporate it even into educational curriculum and assignments, and some of the activities and processes that we have used or we've seen used in agencies and organizations. And then speak about, a larger scale project I'm doing in my community and a national ongoing project that, Allison's doing. So.
So we're going to start with just giving kind of a broad-based definition so that we're all coming from the same understanding when we talk about PAR. So PAR, the definition is really focused on this idea of research that's applied. So that's one piece. A second piece that's critical, it is that it includes, in a meaningful way, relevant parties who are directly impacted by the issue at hand. In rehab counseling, that's often the disability community, but this approach is used in health research and educational research and policy research, just to make sure that the community that is most impacted and has the best view on the issue is included from the beginning. And this idea means that when we say included, we mean from beginning through implementation and evaluation of its impact. That is what makes it different than, for example, just bringing your findings to a community to say, hey, help me understand what happened. What the difference that PAR emphasizes is that they are helping plan and execute the study from beginning to end. Another key point is this idea of not only identifying something happening, an issue, but also changing it. So it's that action in the PAR is really critical and also sets it apart from other research that just shows or explains something. This means that it's a collective process, requires a lot of self-reflection, and centers the people that are most impacted. So prioritizing empowerment and control over circumstances. So instead of just admiring a problem, you're identifying it, understanding it, reflecting on different aspects of it, and then asking that community to drive some kind of change over that circumstance. And inherent in this approach are a couple of key points that we just wanted to unpack a bit. Whenever you and I'm coming from the voice of a researcher. So whenever a researcher or someone from like a more academic or policy-oriented place comes to a community, it's really important that we're mindful of those power relationships. And it's really inherent on the researcher to make sure that they're deliberately partnering in a meaningful and authentic way with those community members. I think that's something that in the years that I've been working with different communities, the reception that I often get in the beginning is like, oh, here we go again. One of those nerds coming from the ivory tower to work with us and then kind of disappear. So we've seen a lot of examples where researchers don't do that well. And it's not easy to do that well, which we'll talk about later. So when we say, how to get the community involved from the beginning and all the way through, some of the ideas or topics, that we want to be mindful of in those dynamics are really consulting the community and coming to them to find out like what are the relevant questions to be asked. What would the right or most meaningful way to approach those questions be in your mind? When we have findings, when we're at that point in the study, what do you think the interpretation is? And then what actions do you as a community believe should follow? Not me, in this case, especially if it's a community that I'm not part of. Inherent in this approach, there's a really strong emphasis on cultural validity. That could be disability culture. It could be a racial or ethnic culture or another identity-oriented culture, but that is the center and the focus of the planning and execution of the work. This is really in direct contrast with a typical research process where a researcher like me might come up with an idea, plan it, execute it, and then bring it to a group, but not really meaningfully consult or involve them in my work. So a few traditions and approaches, within this big umbrella of PAR. The first one is community-based participatory action research, and that is probably the most well-known version of it and the one that we've been talking about so far. So that's often researchers and community organizations working together in an equitable partnership focused way. There's also critical PAR, like using critical theory, usually something like discrit or um, critical methods, where there's a really strong focus on identifying and addressing power inequities, focus on issues related to social justice, or emancipatory theories. And I have one example of a doc student from Penn State that I'll share later on that really focuses on that idea. There's also this idea of participatory or empowerment evaluations. So a little bit different than like traditional theory-based research, but in my mind, even more, I don't want to say more important because my advisor might be here somewhere, but really critically important to community organizations. It's really necessary, especially in today's climate, for community organizations to have good data to show that the work they're doing is making the impact that they hope it's making. And this participatory approach to evaluation means instead of the researcher coming in and saying, here's what I think you should measure and here's how I think you should do it, but that group defining for themselves to say, here's the impact that we think we make. Here's how we would conceptualize it. Here's how we want that cycle of evaluation to go back into feeding into how we might change or not change our practices as a result. And then finally, action research, which is less explicitly participatory, but may be practitioner led, potentially not necessarily including the larger community. And the benefits of PAR, I think for me, I almost can't imagine doing work any other way because and I have for many years. I have a lot. I say to research partners, I have a lot of ideas, but not all of them are good, and not all of them are useful. So for me, I think the best work that I've been lucky to be a part of has come from this approach because it means that people who know things that I do not know are helping me fine tune, guide, identify like what is the problem that we should be focused on? What's the most critical issue at hand? What would be a good solution to that? And even though, 20 years ago I was a VR counselor in a state agency, things have changed in 20 years. Being a VR counselor in one agency doesn't mean I understand all of them. So there's just so much that not like no one person can know that put together can really inform and improve the work that we do to make it impactful. This approach allows each partner to leverage what we're good at and bring those skills together. So I come with like nerd skills, and they come with context and community knowledge and insight that I just don't have. And together, that can be really great. It's also, from a rehabilitation counseling perspective, really consistent with the idea of disability justice. Tony Saya wrote a really great paper with colleagues, published 2024, that's available in our resource packet that we'll show you at the end. And they go through, the history of rehabilitation research and how it really hasn't valued the research, the disability identity, community voices, and this approach kind of meets that need or meets that call that Tony and her group put out for us.
I have so many things on my screen. I had to get off mute. Sorry.
Okay, yeah, sure. I think it's your turn
Um,
anyway.
but what's interesting and, especially with the benefits of PAR, I mean, I find it like energizing. I don't find coding data energizing, and especially when you're doing it in a vacuum. And even if you are working with a research group, um, one of the projects I'm going to share today, one of the first sessions that we had, we were like, all right, so what should we do? And like our question that we first put on the board was like, what question isn't being asked and what project isn't being funded? And so it was like it's just walking out of a meeting that you're going to have to put a lot of work into and feeling like, yes, now we can do this is like very exciting. But as kind of invigorating as it is, there are challenges. I think that sometimes I'm envious of, some of my colleagues who are doing more purely quantitative work because they get their data set, they can crank on it, they have their output, there's not as many iterative processes. So it does take more time. And, obviously with us being in academia, sometimes time is of the essence. There's ebbs and flows of a school year. And oftentimes, a lot of these projects are grant funded and you're working within those time constraints. So it can kind of be difficult, especially when, you have funding deadlines, but you also have deliverable deadlines. So when you are considering engaging in this type of work, especially if it is more kind of academically driven, publication driven, grant funded, you have to be mindful of those things and know ahead of time that, sometimes it's not going to fit as neatly into that box. Also, too, unfortunately, there can be less prestige sometimes given or value given to qualitative versus quantitative. So considering, that some of our scholarly methods or some of the metrics that we as academics might be seen as beneficial for our advancement, our promotion, the value of our work, might not fit with what participatory action, research is. That it might, even though it's something that's important, if it's not going to be valued, if I spend a lot of time on a project and it's not going to be seen as important perhaps by a community or as important as at a university, that can be difficult. I mean, I guess what's great is that I'm 20 years in and I'm a full professor and, I can take away some of those constraints for myself and really get to the things that I want to be doing. But I think too that you have to really have an investment. It is relationship building, and you don't want to get into this work and have it turn into drive-by research. What you're trying to do is leave something behind or remain in that community. Yes, projects, end, but you want to be able to leave information or you want to be able to like leave infrastructure that's in there. And that takes a lot of investment up front in making those relationships because, you have to build trust. People are, you know, um, entrusting you with their story, with their viewpoint. And sometimes agencies or community members have kind of been burned in the past. As Allison said, the nerds or the academics that kind of come in and we swoop in the past that has not been well received. And sometimes we've found in the history, if you've ever done an IRB training, that there have been adverse outcomes of research, where people weren't informed. So we might be working either based on our positionality or, the dynamics of the group that you're working in. You might have to overcome some skepticism. It really, requires you to be open and honest, to develop those relationships, to, you don't just want to be like, oh, I'm not like them. Don't worry. Like you have to prove it. You really have to be embraced by the community that you're working with. But I think too that when you are engaging with a community and you are a little bit enveloped in their story as well as their passion, as well as their struggle, you want to make sure that still what you're doing is doable. And you can't go into a project and feel that, if the community lays a lot of needs at your feet, you can't say, all right, we're going to solve all of them, or we're going to make sure that we uncover every stone and make sure that every member, because sometimes that might even dilute the research, so really having that, there's a tension between somewhat of practicality, of what we can accomplish and who's considered the community or who's considered a stakeholder, making sure we get good representation. But sometimes, someone might feel left out and you have to work with the community. You have to realize, maybe that's another project, that's another carve out. So there is a little bit of a tension of when you get embedded with a community that you really become really, indebted to their ideals and grateful for what they're doing. So, keeping a little bit of that objectivity within the process, can be sometimes more difficult. It's not numbers, it really is people at this point. So we want to talk about participatory action research kind of on a continuum because like I said, it can't be one size fits all. Depending on the nature of the work you're doing, depending on, the resources you have available, depending on the time of the community as well. Because you might want to come into this and do this purely authentic participatory action research model where you're engaging community members at every step of the way and having them locked arm in arm with you at the same time, but they might not be able to give that amount of energy. So the idea is that we want to present this kind of as a continuum, that the goal is always increase voices of the folks most affected, getting input from stakeholders, checking our viewpoints, really checking our position. All those sorts of things are important, but to what degree? So you'll see on this continuum that it can kind of span between how are we using community members more as consultants? And again, not at the end, not as Allison said, like, oh, we found this, what do you think? But use them in consultative roles so that we might have the wheels cranking on the academic side, but we find the places where we have to step out and say, all right, let's check ourselves now. Let's, what questions do we need to ask? Okay, now we have the questions. Now we do some things. Now we start the process. All right, now we have the data. Now we're going to bring you back in and really see and make sure that there is that reality testing along the way, all the way to hopefully projects where we can be co-researchers. We can really share the leadership and equal partnership kind of in it. But that again has to do with the resources and energy of the individuals you're working with. So we're gonna kind of talk about some examples here that show different ways that this can be conceived, both in the community on different levels of scale, but also kind of in the classroom. I don't know, who on the call might be an educator today, but I think it's also important that even at the master's level, because we embed research very deeply at the doctoral, preparation level, but even at the bachelor, the bachelor's training programs and the master's training programs, how can we get students to start to think this way as well, so that when they're out as practitioners, they can even try to incorporate some of these principles in the work that they do. So first of all, there is a way that we can start to expose students to increasing more participation of viewpoints into any work that they do. Assignments that we have, projects that we have, we really can expand on this principle. But also thinking, much like I said with the research, it's not like they're just going to go to the library, get 10 articles and write a paper on it. That might, again, someone could cram that into a single evening, but a good research paper would probably take a week or two. I'm gonna describe two projects that we use at Hofstra, that one spans 2 semesters and another spans an entire semester, because knowing that if you're going to be using less traditional methods, that you need longer time. And we also have to keep in mind too, I think that there's a little danger when we want to include voices, especially when it's engaging with a student assignment, that we're not then putting the burden on the community, especially when it's the disability community. Oftentimes it'll be, hey, we want you to understand disability more deeply. Go find a person with a disability and make them talk to you for 2 hours. So we want to be mindful of those things as well. So two things that we do that can be curricular examples. One is something that we do across our 2 internships. So students will gain foundational kind of concepts throughout their research class, in methodology, their case management class and their job placement class. So thinking about, how do we engage stakeholders? How do we talk to employers? How do we engage with, our clients in meaningful ways and ask good questions and all those sorts of things. So they have a basis for this before they come into their field work. So we do have one faculty that actually teaches all of our field work. So she implements this as a continuum. So over the course of the 2 semesters, students, when they go into their internship site in that first semester, they start understanding the nature of the setting they're in, the people that they're interacting with. And then they start to evolve and have conversations within their placement about like what's an issue, what's a need, either speaking to the clientele and the consumers, of the services, speaking to the administration, of where they are, or speaking to the workers, speaking to the employees within that to get to understand it. And then they work within to help kind of co-design and develop what is a way that they could address that need over the remaining time and into their second internship. So the goal is by the end of their second internship, they're going to make a presentation for something to implement at that site to make it better. So 2 examples would be one of our students was in a community-based rehab agency serving individuals with mental health and substance use disorders. This organization provided broad services across departments, and programs. So they were a little kind of siloed, even within their own organization. And she was placed in the vocational services program, and she felt that she was recognizing that there was kind of an underutilization of the services there, recognizing that it would be a really holistic part to the treatment for the folks who are being served by this agency. So she realized that, okay, well, what do we have to do? Who are the best people to engage in this process? And she decided it wasn't really the clients, it wasn't necessarily what they needed. It was they would be the ones to benefit from it. But she decided to speak to the employees in the other departments. How is communication, offered? Do you know about our services? And so she really did assess to improve the communication across programs. And that not only improved utilization of the vocational services, but it actually improved utilization of other services across the agency. We had another student who was at a multi-department kind of hospital setting that did have a vocational program within it. And there she realized that, sometimes clients kind of would bounce kind of in inpatient, outpatient programs and utilize various services because it does work with psychiatric and mental health populations. And so she realized that, uh, depending on where the client was, they weren't necessarily getting their needs met from the vocational services. So she talked to clients and patients who were in the various departments and got to know that what their needs were. So what someone needs in an inpatient unit is going to look different than the outpatient unit. And she was able to implement a newly revised curriculum that would be more responsive to the client needs and to the patient needs, depending on what service they were receiving. Something that is a little bit more contained in my medical aspects of disability class, I introduced within the first week of class that our class is already broken into teams, and each team is going to be doing a health equity advocacy project. So within their groups, they kind of co-determine what's an interest for them, but then they are able to, define an issue that has something that's been relatively unchanged over the past 10, 20 years. And they're going to work to address it. So I did a little, I'm a person who watches the competition show The Voice, and I realized on that, I've done this project in the past, and I realized that students would always come to me when I say, hey, you got to go talk to professionals, you got to do this, you got to do that, you got to get voices. They would always come to me to help broker that relationship for them. And I was like, well, that's kind of hard for me to do. So this year, I took a page out of The Voice and I assigned a community-based mentor to each program, to each team, who actually happens to be a graduate of my program. So people were out there doing the work that's connected to whatever their interest was. And then that allowed them to engage more deeply, to get really a boots on the ground perspective. That mentor then in turn was able to direct them to professionals. In some cases, even some clients, especially in the form of peer advocates who are both spanning that role of lived experience and individuals who were in a professional capacity. But I also tried to get them to look at other places to find kind of those non-traditional outlets for lived experience. Yes, going to the library is great. Getting research-based articles is great, but diving into Reddit, diving into X, disability organizations, finding some of the voices that are out there already so that we don't have to put the burden on them. And I just want to share because I'm super proud of them. They're actually going to be presenting some of their research at a disability event that we have in October. One group had a project for advocacy for education regarding non-apparent disabilities for current nursing students. Another had accessibility barriers for transition age youth who are basically going to be making the move from youth-based to adult-based healthcare services. And the other was the continuity of mental health care before, during, and after incarceration. So really amazing stuff. And they felt very moved by the work that they did, aside from just cobbling together, research-based articles. They really felt empowered by the experiences. And now they're talking about, all right, now what do we do? How do we implement this? And how can we bring it forward? So other things we can think about within our community on a really smaller level, if we're thinking about our own agencies that we're at or systems that we're working in, an easy practice probably to implement anywhere, having a consumer advisory board, bringing the voices of people who use your services or are alumni of your services. We do this in academia with our professional advisory boards anyway, so we can mirror this out in the field. Obviously using surveys and focus groups and tapping into the actual voice of the clients that we're serving. And Allison's going to share a little bit about a new project she's working on with a student.
Yeah, and I can't take credit for this.
Yeah.
It's a doc student at Penn State. So at Penn State, we have an inclusive post-secondary program for students with intellectual and developmental disabilities. And one of the doc students who works with our training grant focused on transition and intellectual disability, when she came to Penn State, she was interested in sexuality and what kind of access disabled people have to information about sexual health and also healthy relationships. So that was something she had in her mind. She spent about 3 years working, volunteering with our IPSE program, so Inclusive Post-Secondary Education Program. And she used that experience, talking with students, responding to questions that they had about relationships. If you've been to college, it's a pretty socially dating focused environment. So our students come to campus and then, they want to do what everyone else is doing, which is finding partners, hooking up, doing all the things that college kids do. And Cassandra really wanted to, like, she identified this issue during her time spending with the students where they had questions about dating. They had interest in dating. Some of them talked about, like, well, I don't know if I'm allowed to date. And so she just got the sense from them, the feeling from them that they had unmet information needs. So she spent a lot of time consulting with the students in our program to try to get a sense of, like, well, what is it that you want to know? What kind of curriculum should we have in programs like ours at Penn State and nationwide that would meet the students' needs? So she used that 2 to 3 years that she's been with the program so far to inform her dissertation, which she's doing right now. And what she came up with to do this is a draw and write study to have the students explain to her in multiple formats. So they're going to draw a picture, they're going to write a bit, they're going to interview with her so she can get a better understanding of, like, how do people see themselves in dating and relationships? What do they want to know? What do they wish they could know, as a way to inform curriculum? So she has really engaged with this group all the way through in identifying what the study should be about, trying to figure out what the best way to execute the study is, and then, of course, having the students direct the impact, which will be the curriculum that comes out of her work.
Yeah, so I mean, it's great to see, some of these live examples. And um, at the end, we have, some links to a lot of the things that we used in development of this presentation. So I don't want to go deep into these, but just, what's helpful to me sometimes when I'm starting to think about new ways and new methods to implement into the work that I'm doing is see what other people have done. So, there's a link to a couple of these studies as well, but, in the case of Skoy and Weremeyer, they're using pictures, photo voice, which is an arts-based research method where individuals document and communicate kind of their own reality. So they had students with mental health conditions on campus, like taking pictures of like what is it like to experience life on a college campus with a mental health disorder. And through this then processing those pictures, having discussions, and then making kind of policy and practice implication suggestions for what should change on their college campus. Smith and colleagues had a youth council, in their local area that kind of recognized, especially after COVID with remote learning, that there was a lot of isolation and that it was impacting on their mental health of these youth. So they partnered with mental health and community researchers in psych and public health. And through kind of surveying some of the students that were engaged in remote learning, they were able to create a virtual peer-to-peer support network and advocate for like screen-free mental health days for students who were being educated, online. Meyer and colleagues, again, this is not a disability example, but I think it's an interesting methodology that they use. There was a problem with flooding in certain neighborhoods, and the problem is, it's hard to figure out where resources should be used. So they utilized geographic information system flagging. So you can go and you can kind of like geo track where problems are. And they were able to crowdsource a community map of the area to be able to then advocate for the town planning board to say, hey, this is where we need help. This is where we need to update storm drain maintenance. This is where we need some action to happen. So using pictures, using surveys, using these mapping techniques are different ways that you can engage the community to try to implement some changes. And this Thomas article is actually a scoping review. So it actually reviews 87 different PAR studies that are aimed at serving mental health populations. So if that's a population of interest for you, I would direct you to that one to get some really good ideas about some of the work that's been done. One study a project, I mean, I guess I can't call it a study until I publish it, right? But, that's what me and my research team are going to be working on this summer. I've been engaged. There was a grant offered through our dean's office, a seed grant for a community, actually just for any project. And again, something that I like to do is, who are the Avengers? Like, who do I need to assemble in order to work on something? And again, I like the fact, as I said, that I'm a full professor and I don't have to be too constrained, but I also want to figure out ways to help junior faculty members. So I actually paired with 4 junior faculty members on this project, and I'm in a very interdisciplinary school. We're in the School of Health Sciences. So we have our counseling and mental health, but we also have population health. We have kinesiology and applied health, and we have occupational therapy, physical therapy, and speech language pathology. So there's a lot of kind of different um, specialties within our school. But what we did find is that kind of the common thing was that we all have a goal around health equity and creating a culture of health. And so we also recognize that we want to increase opportunities for our students, how to engage, and also, really strengthen the reputation of our university, among our communities, not again as the ivory tower, but as someone who is a critical player within our own community. And so, but we wanted to make sure that, we could do some work to help address their concerns. So we took a framework over the 18 months of focusing on the social determinants of health, as our starting guideline. And so that led to community surveys that we developed of recipients and providers of kind of social services that were related to the social determinants of health. We also did our own photo group project, where again, we invited community members to take pictures in their communities of both health equity challenges as well as health equity like celebrations and resilience. And so we wanted to be able to, because, if you're trying to enact any kind of influence on policy, you need numbers in order to move the needle and you need data, but you also need stories. And so we realized that visual images of how health equity was being experienced were really hard to ignore. Even more than the written word or a vignette from a person. So that was something. We have a creative arts therapy counseling program, and so they really drove that one. We also then, so we took those needs, and then the goal of this was to develop community university engagement projects. So we then started talking to these community members, these agencies and organizations that serve the community, and said, okay, well, what's stopping you? What do you perceive as the roadblocks? Allison and I just gave you the benefits and the challenges, but like we wanted to hear from them. And so a lot of those things came out, the idea of, yeah, it's great. We get contacted all the time to be a partner, but then it's like once they get the grant, there's just very limited involvement in what they do. They needed, in order to get the grant, to have 3 community partners, but the community partners really don't have voice. They don't feel like it's their needs driving the agenda of whatever the project is. And so that was important to us, to really take those, we're going to be publishing kind of our findings on that as well, and the voices of these community members to say, hey, we need to use the best of your resources too. Because so much of what they said was a need for them was like, they don't have the manpower. They don't have the resources that a university has. They don't have the reach that a university has because they're just one little organization. So using that is important, but they also realize that they also get involved in a lot of coalitions that just go on for years. And they, 5 years in, you're like, why did we start this? So they also recognize that getting involved in projects, you don't want it to be in and out, but you also don't want it to be this thing that goes on forever. So that was kind of important to us. So we're going to be developing, our surveys, our photo voice, and our focus groups into some policy briefs that can help our local legislators and funding sources, address some of the needs. But then we said, all right, but what's the action? What is truly our action? If we said we want to work with people, let's work with people. So from those interested groups, from our focus groups, or people who wanted to be engaged in the focus groups but actually couldn't make the focus group, we were able to find, originally we had 3 organizations that were interested, but one of them is going to be addressed in a different way. But we found 2 community-based agencies that are going to continue to work with us over the next academic year in kind of curriculum-based work. So using our students, our manpower, our resources, and help them solve a problem. We were able to showcase this both in our photo voice exhibit and our exhibition, where we went through everything for the project, which was part of our National Public Health Week event that we hold at our university. So now we are going to be doing our collaboration implementation. And so, what we tried to do is say, hey, let's focus on what can we do in the next academic year. We're not saying we're not going to continue to work with these individuals, but if at the end we want to reevaluate, was this beneficial to you? Do you want to work again? Do we want to continue on this project? Or we can go through the same iterative project process to find a new community member. So again, we're pretty proud of this. We are going to be working with one of our projects is going to be with AHRC, that is an organization that works with individuals with intellectual and developmental disabilities. We're partnering them with our Department of Population Health. So we really saw that students in community health, health administration, and public health would really be good at this, because what they realized is that there's not a lot of education on the part of um, especially first responders and healthcare providers on the needs of intellectual and developmental disabilities. And they realized that they had actually developed some curriculum, and they have such great knowledge about this population. And they had definitely done some good outreach, definitely did some good curriculum development. But then they didn't really have a way to get it outreach. They didn't have the connections. They didn't have the manpower to put into that. So they want to, the aims of the project are going to be to develop more comprehensive learning models. We're going to actually develop some of that within classes that we've identified. We're going to be kind of collaborating to bring together some of the community partners and do the outreach to our first responder community as well as our healthcare providers. We have a connection to Northwell Health, which is one of the biggest providers in the Long Island area that's affiliated with our university. And so we're going to start a deployment in with there, and then finding more unique ways that our students can be involved. So that is going to be a super fun project. Another that I'm really excited about. We're going to be partnering with Mental Health Association of Nassau County, and we're going to partner this one with my department, the Counseling and Mental Health Professions. And so we're going to be doing We Are You. We're going to be doing an anti-stigma campaign. We want to try to find a branded campaign that we can then um, kind of create a template for it that we can deploy into schools, into workplaces, into communities to really destigmatize mental health and substance use, recognizing that it could be the person next to you, and really try to create public awareness through social media, storytelling, other types of things to really get the voices of lived experience out there and try to make it less scary and realize that it's a community response that we need. We're going to be doing listening sessions, partnerships, and really trying to bring this together. And what's great is that even just in partnering with this organization, they've also said that they have workforce needs. They have positions they can't fill. We're now partnering with majors on our campus to try to fill their workforce needs or get intern placements. Then they just reached out to us because they're doing Robert Wood Johnson Foundation. They're submitting a letter of interest for veteran mental health needs. And it's funny because we have a community-based agency reaching out to us as the academic institution, not the other way around, saying, "Hey, we don't know this piece, so can you partner with us?" So I think it's just a nice way to now see that we did the research and that part ended, but actually now the real part begins. And so I'm really excited for this next piece to come.
Oh, that's very cool. Actually, I haven't had a chance to hear the whole story of Andrea's project until now. Okay, so I'm going to talk about, I guess, a different example of PR. And this is something I've been working on for the past 6 years in collaboration with Brian Phillips from Utah State University. And what it is what we call the Transition Readiness Toolkit. And this toolkit is available, and I'll show you the map of how it's become more available over time to help practitioners and agencies understand the impact of pre-ets on students in terms of their growth. So it's in terms of where it came from in early days. This was something that actually an agency brought to us. Brian, when he moved to Utah, called the state VR agency and said, "Do you have anything you need help with? I want to do something that feels more useful than the typical publishing grind that some people in research-focused universities can get into." And they said, "Actually, you can. We've been working on pre-ets for the past couple of years. We are spending a lot of money on these services, and we just don't know if they're having the impact that we hoped they'd have." They had encouraged providers to come up with a pre and post test to help them understand, but then they said, "But we can't put all that data together to tell a story for us at the state level. Can you help us?" And so Brian got involved and, was kind enough to bring me in as well. And this was an issue that, even though both of us did research in transition before, had never occurred to me. I've worked in a VR agency. I was familiar with pre-ets, but it hadn't dawned on me that the ways that pre-ets were evaluated under the new requirements under WIOA really didn't involve any kind of quality metrics. And then we understood from agencies that this was something that they really wanted. They wanted to know this information. So from idea conception, never would have thought to go in this direction without them coming to us and saying, like, "We really need this information." So Brian and I thought, like, man, there's a million transition assessments out there. There must be something that fits this bill. So we thought we would just be helpful and try to find something for the group to say, like, "Hey, use this instead. We think that'll get you going," and, off you go. But the more we got into it, the more they realized, like, wow, they're right. There is nothing here. So that put us into a space of, well, we need to connect with agency folks and community providers to find out, like, what do you do when you do this kind of pre-ets? How do you decide between the core pre-ets? What are your goals if you're doing a self-advocacy training? So we spent probably a year-ish, 9 months to a year, listening to different providers to say, when you do pre-ets, what are you hoping to achieve, so that we could take that back to our nerd brains and say like, okay, so what would the metrics be? What would the targets be? But again, never would have known, what even to put in these instruments if we didn't spend so much time listening to the folks doing the work. We also used important time to bring that information to students with disabilities and their parents to say like, hey, can you look at what we've come up with here to see if it makes sense to you? We tested that in front of other folks to say, give us feedback on this. And what we wound up with was this toolkit. If you're interested, there's a couple of articles about it and QR codes. And now we're in a space of kind of checking and evaluating the impact of this work. So, Andrea, can you move me to the timeline? I think that'll help me speed this up a bit. So, the participatory action component of this project has really been all the way through. As I said, idea, never would have thought of it. Then when it came time to say like, okay, we do need to develop a tool, we had to do a lot of listening to understand what those target outcomes would be, what the core services would be. And we really relied heavily on community members and that provider and agency staff group to evaluate down to the item what belongs in this toolkit and what doesn't. And we also, partnered with groups to do pilots. We had to take feedback on like, how is this process working to do a pre-test and a post-test with students in community rehab settings, which is not something we've done before. What do we have to change about the process to make that doable for you in your job setting and context? It became clear after doing that pilot that we needed to provide a bigger structure. So Brian, started a company that built software with his brother, accessible software that would allow easy administration and scoring and use of data for those providers. Those providers have given that group tons of feedback on what do we need to see, how is this working for us? How do we need to tweak it? We also wanted to bring it, beyond that one pilot group. We got some funding to expand it to 5 more states. For us, that meant bringing them everything we've done and saying, okay, so this made sense in Utah where we started, but does it make sense for you? Talking to students and parents again to make sure that what we were providing was a fit, and then supporting each state with their own version of implementation to get this tool out to their providers. It's been super fun, super challenging. We get a lot of feedback. We remind everyone you're not going to hurt our feelings. You can tell us, what's working for you and what's not, because we see you as the experts in this role. Can you go to the next slide, Andrea? And now I just checked the website to see what we're up to. So now we went from that one pilot in one state to now we have users in a lot of states. I think we're in 9 states now. So we've got Montana, Wyoming, Utah, Colorado, Oklahoma, Michigan, North Carolina, and Rhode Island, who've all adopted this tool at a state level. We've gotten feedback from users in all of those states. Best Buddies International has also started using the tool, so that means that it's available in a number of other states through that organization. And I was just looking to see the numbers. So over the past, I think, 4 years since the software was developed, we've now collected over 93,000 tools from 21,770 students. So the outreach, has become quite wide scale over time. And now, because we have so many users and providers using the tools, we started interviewing providers with high average change scores. So using our metric, who as a group seems like their providers are really making a big impact on students' confidence and their knowledge and skills in these important, agreed upon across all the users, core areas of pre-ETS. And now we get to say, okay, tell us about the great things you're doing. And for us, we talk about the importance of evidence-based practice. I mean, that should come from the field, right? Like that shouldn't be something that a researcher decides, because then will that work in real life is always the question. It often doesn't. But using this approach of community focus all the way through allows us to identify good work and then just be able to share it, which for me feels like a really comfortable role of a researcher since I don't do pre-ets every day. So I shouldn't be coming up with the practices that should be shared across the country. So just another example of nerding on a larger scale, I guess.
Awesome. And, just to kind of, bring it to a little bit conclusion here, I think, what's important if we're gonna, distill this down to some of the takeaways, I mean, I think it's nice to think about what's the foundation of it, but I think it's helpful for me and I love seeing, the work that Allison and Brian do to figure out like I could never think of doing this model on that scale and it's useful, so anything from your tiny little organization or even in your classroom, you can have principles all the way to developing something into a national model. So obviously, if we're thinking about how to do PAR well, we have to have our ethical principles at the heart. So, obviously, do no harm. We're promoting wellness. We are trying to grant autonomy to the folks that we're working with, but also keeping your promises. Don't drop the ball. So I think that that's something that is at the forefront of what we do. It does require a certain degree of transparency, developing strong lines of communication, involving people at all phases, of the research process. Um, Definitely making sure that we don't create, however, unrealistic expectations, because you want to keep your promises, but you don't want to overpromise. And also distinguishing between not coming in and saying, we're definitely going to change this. We're looking to move the needle. We're looking to exert some influence, but there's going to be things that are outside of our control. As mentioned many times, we're centering those who are affected. We do not want to tokenize and we do not want to turn this into performative work. This is not a checkbox on a grant application. We don't want to ask for feedback that's going to be ignored. What's interesting, is kind of like how I always tell my students, the goal of counseling is to make yourself not be needed. It's kind of like the metric of a good PAR facilitator comes from actually being less central to the project over time, that it gives more ownership to the folks with whom you're working. Building those relationships and sharing in the decision making, it really gives power, in the decision to those who will be most affected by it. But it also, in the work that we do, because we're researchers, sharing credit for their role in the work, not just saying, oh, we talked to them, like sharing authorship, sharing presentation space. Like I think, that was a big thing when we presented our work, is that I stood up there, with Jeff, who is the CEO of, Mental Health Association. And it's like, this is what we're going to be doing. So like, we both just said it. So now we got to be held to it. We have to make sure that we prioritize access. Obviously, in working with the disability population, we take that to mean, accommodations and whatnot, but also in many different ways, in the words that we're using. Is it plain language? Is there a need for translation with the community that you're working with? Making sure we're not overly academic and not, accessible from that standpoint. Prioritizing things like flexibility and scheduling, childcare if it's needed, compensating people for their time, making those accommodations, but also the accessibility of the methods. I really love what Allison's saying about her student's dissertation, because it's like to put pictures and words and interviews and all these different ways of expressing. So we can use storytelling, we can use the pictures, we can use the mapping, the visual methods. We can come to them instead of always making them come to us. But constantly and consistently practicing reflexivity. So the idea of considering your assumptions, your positionality, privilege, any power dynamics, but also continuing to revisit them. Oftentimes in research, and I know in projects I've done with Allison, we start with what's our positionality statement? What's our inherent biases? It's good to do it at the beginning, but we have to continue to check. Did we think we were going to find this? Did we come into it with a grounded assumption? Um, but making sure that we have a kind of action cycle. Plan, act, reflect, revise, repeat, being able to continually move that along. I don't think Allison could have gotten to her timeline if they weren't using that, continuing to reinvent how they're looking at things, but then making sure too that the project doesn't end at data collection, that we have to deploy the benefits. And that leads itself to sustainability. So, how do we leave the community better? How do we leave them with skills, infrastructure, support, toolkits, briefs, workshops, curriculum? What is the thing that we're going to leave so that we hope it can be a better place? So, we hope that you enjoyed your time with us today as much as we did. I know there's not really a lot of time for questions, in this format, but if you scan the QR code here, it will give reference to everything that we discussed today. Obviously, if you want a deeper discussion on any of this, Allison and I would definitely make ourselves available to that. You can get our contact information from ARCA on that, but we hope that we'll have more partners. I'll put my email in the chat just in case, and Allison, I'm sure will do the same. Uh, and I think that's how I spell my name. And so if you need anything, please reach out if you have any questions about that. But we enjoyed our time today and we hope that it's beneficial for the work that you do. And I think with that.
Well, thank you so much. I really appreciate it. I had so many ideas. I kept jotting down ideas for um, my classes. And one of the questions that I had directly to me is this something that can happen in the real world, not just in academics and research? Is this something that we can do in our offices in the community?
100%. I mean, so much of those things like doing focus groups and, bringing in your agencies the voices of either, if you're an agency like a VR that serves providers, like what are you doing to reach out to those providers to talk? What are you doing to reach out and get the voices of the folks that you serve? Allison, where are you seeing?
Yeah, and I think anytime, like if you're in an organization that provides services, like anytime you want to reconsider or come up with a new initiative, like leverage your community to help you plan and inform that. I think for me, I always worry when we start something new and there's it's crickets. And for me, that when I've had that happen, it tells me like, oh, I didn't hit the mark well. I should have consulted with that group ahead of time to really make sure that I'm on point with what I'm offering. Are we offering something that people need and want? Are we using terms that make sense to the intended users of this service that we're planning? So yes, I think absolutely real world is the place for this approach.
This is more real world than a lot of the quantitative things that you're seeing in academia. So this is what it's made for. And like I said, the scalability is the only thing that you're really looking at to what end, what are your goals? And just start with a basic question, but then allow the community or the people you serve to really shape those questions as you're going forward.
Excellent. Well, thank you. Appreciate you both being here. And thank you to those who participated today. Thank you for being part of the Virtual Learning Institute. And you all take care and have a wonderful weekend.
Bye, everyone.
Thank
Thanks.
you.